We want to welcome everybody who took the time to join us for this presentation and really just in an informative workshop that we've really put together in a collaborative effort between a few of our agencies here locally in the Birmingham region. So we thank you for taking your time out to join us, especially with such uncertain weather that's going on outside. Maybe not so bad here, but if you've got family across the state, we sure do hope that everyone stays safe over the next few days. But we'd like to welcome you. We've titled this presentation Dementia, the Disconnect, Connecting Caregivers to Resources. Again, this is brought to you by a few different programs that we have not only in-house, but also an external resource with People First that's located here in the Birmingham region. Again, that's the Middle Alabama Area Agency on Aging, also known as M4A, and People First of Alabama. Additionally, involved with M4A's portion of this program, we do have our new PANDA project, which is providing Alzheimer's and dementia assistance, and our Alabama Cares Caregiver Support Program, which we will go over both in just a few minutes. Did want to kind of have some to remind viewers that we are doing this in a webinar format. So if you have any questions, unfortunately, you will not be able to ask them out loud. However, we do have a workaround that we also have a Q&A box and a chat feature. So if you do have any questions, feel free to ask those as we go, and we will make sure that we get those answered to the best that we can from our panelists as we go along. So again, if you have any questions, feel free to ask those in the Q&A and or the chat feature. We are not broadcasting this live on Facebook as we do many of our videos. However, we will be copying this, recording it, and kind of editing it to get a cleaner version of it to put on our social media streams. And if you have any questions, feel free to ask those on our YouTube channel and on our Facebook page after we post these. So today's speakers is myself, Jeremy Rains. I'm the Alabama Cares Caregiver Program Coordinator. Ms. Jennifer Fuller, who's the PANDA Project Director. Ms. Crystal Whitehead, who is our Caregiver Interventionist with the Alabama Cares Program. And Ms. Susan Ellis, who is with People First of Alabama. Today's agenda, we'll be going over some of our in-house programs at M4A, some of the programs and services that we offer that might be of benefit to you and your loved ones. The PANDA Project, of course, IDD caregiver resources through People First of Alabama, as well as other external resources. And finally, our Medicaid waiver programs that we have in-house as well as across the state of Alabama. To kind of give you a background what M4A is, we're part of a network of 13 other area agencies on aging that are scattered across the state of Alabama. As you can see, we're right there in the center. We kind of cover the central region, basically the counties that kind of surround Jefferson County. However, we also cover Jefferson County for our senior employment program. As a network, we operate in all 67 counties, and our motto is simply to age in place within the community. That's really our mission, that the driving force behind doing what we do as a network, and a lot of our core services that we provide in-house in our agency is covered across the state of Alabama. So if you hear about something today or a resource that you might find out about that M4A offers, it's best to really inquire with us to see if that's something that's available outside of our region. If you have a loved one, or if you maybe live in a neighboring county, then that's always an option to let us know. We might be able to connect you to those services in your area. The areas that we cover, I didn't see it listed there. The areas that we cover are Blount County, Chilton County, St. Clair County, Walker County, and I think Shelby County. How could I forget Shelby? We're right here in Alabaster, so that's our home county. Again, that's Chilton County, Blount County, St. Clair County, Walker, and Shelby counties. And then with our CSEP Senior Employment Program, we do cover Jefferson County as well. So the 5 core Older Americans Act services that all AAAs offer, we do information and referrals, in-home services, homemaker and chore services, transportation assistance. There is limitations on some of these programs, i.e. the transportation programs. We do our best to offer supportive services with that, partnering with local organizations to try to identify maybe programs and organizations that offer transportation, as well as some of the benefits of, I'm sure that Crystal will probably talk about this in her Medicaid waiver program with the net voucher program that offers transportation assistance through that. We also have case management services, home modification programs where we can assist and try to identify local organizations and volunteers to build things like wheelchair ramps, grab bars, whether there's a door that needs replacing, whatever that really, the type of service that can really be justified to help improve quality of life, but most importantly, health and safety. We also partner with an elder law attorney out of Opelika that helps us with legal services. So if you have someone that you know that is of eligible age, and even if not, we can try to find the resources available, referrals to make to individuals who can, on your behalf, help with things like advanced directive, powers of attorney, wills, etc. So we also have programs with Elder Rights, as you see there on the right, that includes abuse prevention and long-term care ombudsman programs. We're really big into elder abuse prevention programs. One of our panelists that's on this call, our marketing director, Ms. Robin James, she started a new initiative called Take a Stand. And we do those, I believe, every other week, where we do something similar to this, where we welcome a local resource to come on and talk about different things that you can do to kind of equip yourself to identify and prevent elder abuse, as well as other information. But so we have a really big drive to really prevent and to be a voice and a liaison as it relates to preventing elder abuse. And of course, we have two long-term programs, or one primarily long-term program, but we also have a local ombudsman who kind of serves as the individual who speaks on behalf of the resident if they're in a long-term care facility. They're kind of the middleman, I guess you could say, in between the facility and the resident to speak on their behalf, to kind of mitigate any issues that might be happening, or take any concerns to kind of explore those and look into them to see if they can best be resolved. And we also have long-term care options where we offer, primarily with our Medicaid waiver program, to provide services in the community to help to delay long-term care placement for individuals who might be on the threshold of long-term care placement. That provides things like homemaker services, personal care, as well as other in-home services like our caregiver support program with our Alabama Cares program, which we will go over in just a second. How it all starts for us, we have an Aging and Disability Resource Center, also known as ADRC. So when you call, you're basically calling a single point of entry for long-term care supportive services, whether that be food assistance, whether that be transportation, whether that be caregiver supportive services, whether that be a wheelchair ramp, VA benefits, whatever. You can call and you can come into our office. You can even submit a referral online now, which is actually our next screen. But you can connect through us to get a full benefit screening to see what types of services you might be eligible for and what might be able to help your family out. So you may call for food assistance, some type of nutrition, Meals on Wheels, senior center meals, but you may walk away with, caregiver supportive services, a wheelchair ramp, whatever the case may be. So it really serves as a single entry point for you to really, like it says right there on the right, to start here. So if you are not in our area, there's a statewide number there. If you see just to the right there under the telephone emoji, it says 1-800-AGE-LINE. You can contact that number and that will connect you to your nearest area agency on aging to really get things started for you. That is the traditional way of doing things, but we've also introduced an online portal now that you can go to our website, www.m4a.org/referral. And you can actually click on the button there that says either make a referral or get help. And it'll kind of walk you through the steps where you can type in your information and submit that information to us to really do the same thing as if you were coming in person, as if you were calling. You're doing it right there on the computer, doing it whenever it's convenient for you. You can do it on behalf of yourself as well as an individual that you're caring for, or a client, or whatever the case may be. So we got a few options there to really try to adapt to any need, whether that be in person. Of course, right now we do have limitations with our office with the pandemic going on, but feel free to still obviously call or do the referral online, and we can definitely start that process of trying to identify ways to help you out. Again, these are some of our core programs and services. It's just a graphic that we like to use, but to put it simply, legal services, insurance counseling. Failed to mention that a while ago, but that's a very important thing that's coming up. Open enrollment is right around the corner next month, and really just a couple of weeks for Medicare to do open enrollment to identify and look at your Medicare plans, prescription drug plans. That's something we have an expert in-house that will do one-on-one counseling with you to identify the best possible plan that's in this area to see what works best for your situation. So be sure to check out that, and you know, kind of stay tuned to our social media accounts to see when we'll be scheduling those counseling sessions. We also do nutrition, whether that be food stamps or what we call SNAP, to really try to provide that extra boost of, you know, monthly income to help with it's kind of a stipend to help with food assistance. We also do the Meals on Wheels program, is what most people call it. I don't believe that's what we call it per se, but it's similar in that we do homebound frozen meals, as well as we partner with the senior centers to provide the hot meals at the facility. So we've got a few options there with nutrition. Again, the ombudsman program, like we mentioned earlier, that kind of speaks on behalf of the resident and the individual, or excuse me, the facility, to try to be that middleman. We also have prescription drug assistance. So if you are an individual who might find yourself in maybe like the gap period or whatever your scenario is, we might be able to work directly with the manufacturers to identify low cost or no cost drugs to kind of help ease that financial burden for some of your medications. Again, with our senior employment program, that's across our 5-county region, including Jefferson County as well. And basically what we do with that program is we take individuals who are kind of looking to get back into the workforce. We partner with nonprofit agencies across our region to kind of be a host site where we pay for that individual to come to work part-time to kind of help develop a skill, as well as, you know, that benefits the nonprofit, of course. And it also, the ultimate goal there is to sustain long-term employment. So that's really the end goal there, and by teaching a new skill and a new trade. Again, we also have two caregiver support programs, one being our Alabama Cares program, which is our traditional Title III caregiver program, which provides respite services, supplemental services. I think I go in a little bit more detail in the next couple of slides, but that also, in combination with our PANDA project, which really focuses on the Shelby County area, but we do have caregiver supportive services to really fit each need that is presented to us. And finally, our big program, our Medicaid waiver program, is listed as our home and community-based services program, which Ms. Crystal Whitehead will go over towards the end of this presentation. So first up, we have our Alabama Cares program. And this, again, is support for caregivers. It covers the 5 counties that we traditionally cover. And this can range from, you know, anyone that's caring for a loved one with a dementia-related diagnosis, grandchildren, whatever the case. We kind of cover the full spectrum of individuals that need supportive services. So to put it simply, the services that we provide are caregiver access assistance, which is basically things like access to resources in the community, case management type services. We also provide caregiver information for the community. We host events, public forums. We do a coffee break session in collaboration with our PANDA project every other week, where we do an online format like this to allow caregivers to kind of take a break and learn a new hobby or more information about programs throughout our communities. We also provide temporary respite services that allow caregivers to take a break. So if you've got a caregiver who is, you know, in a situation where they really don't get to leave much or run and do errands or go to the doctor or whatever the case may be, we partner with local direct service providers to provide that little bit of a relief for them to be able to run those errands and do things they need to do to really provide the best care possible for their loved one. We also provide counseling and education services, whether that be through support groups, whether that be through partnering with licensed counselors to provide more in-depth counseling or identifying local resources that can help with counseling. We're also just an ear to lean on, or a shoulder to lean on, or a ear to listen to your concerns. If you have to call us and you need to vent, I mean, we're here for that. Me and Crystal, we're really here for that, for you to be able to call and just have someone to talk to in a moment of need. So we also provide supplemental services, which is anything really that's supported to the caregiver, whether that be pull-ups, bed pads, nutritional drinks, Band-Aids, whatever is really the type of service that if there's a fee there that you're really racking up on trying to utilize to provide care for your loved one, we can more than likely help to cover those costs, or at least lessen them just a little bit. So those are the kind of the 5 core service categories that Alabama Cares provides. The eligibility criteria traditionally are for caregivers who provide care to individuals age 60 and older, or caregivers of any age who have a dementia, or that are caring for an individual of any age that have a dementia-related diagnosis. That was kind of the traditional role of this caregiver program, coupled with what we call older relatives, which are not parents, but they're individuals who are age 55 who are informally raising a child 0 to 18, or children, plural, 0 to 18 with or without a disability. In recent years, we've opened that up to include individuals, older relatives that are age 55 and older. That does include parents for individuals who are providing care to individuals 19 to 59 with a severe disability. So now we kind of cover anywhere from childbirth to end-of-life care, as far as, you know, Alabama Cares with supporting the caregiver. So we're really able to provide a lot of care. It is a temporary basis, but we know that the support that we provide is very, very valuable. So now I'm going to pass it over to Ms. Jennifer Fuller, who is the project director for our newest PANDA project, which again is providing Alzheimer's and dementia assistance. So Jennifer, take it away.
Thank you so much, Jeremy. And thank you all so much for joining us. We really appreciate you taking the time out of your evening to join us and hear about our different programs. I'd also like to acknowledge our executive director who is on the call, Ms. Carolyn Fortner. She is just a wonderful support for all of us at M4A, and always encouraging and supporting us in everything we do. So just thank you to Carolyn for that. You can go to our next slide. So the goal of the PANDA project is to provide supportive services to persons with dementia, older adults with intellectual or developmental disability who have or are at high risk of developing dementia, and their caregivers. These supportive services help to improve quality of life, promote independence, assist clients with remaining in their homes, provide support and empowerment, and to help reduce hospitalizations and overall healthcare costs. We received a 3-year grant from the Administration for Community Living, which is a federal agency under the executive branch of government. And so we have, with this grant, developed a lot of different partnerships with people throughout the state. And we are partnered with every major university in the state. With the University of Alabama, we have great support and consultation. We have UAB, we have Dr. David Geldmacher and Dr. Rita Jablonski, who work in the memory clinic, and they are wonderful support and help with education purposes as well. A new thing that we are just getting ready to start in October with our partnership with Auburn University is going to be a medication therapy management program. So we're very excited about that. So they'll have pharmacists who can look at what medications people are on, and are they causing interactions, and are there issues with those different medications, and really looking at and talking to the doctors and saying, well, maybe we shouldn't be taking all of these. We're also partnering with different hospitals. We have Brookwood Baptist Hospital. Daniel Listy, who is the CEO of Shelby Baptist, is a partner of ours, and he is so excited to help with referrals and to just help in any way that they can to get the word out about our program to more and more people. So we keep building our partnerships more and more all the time. So this slide of all these different puzzle pieces of our partners has grown in the years since we've started this grant. So we're really excited about that. So some of the direct services that we provide in our program is the one that I feel is the most important is our person-centered and family-centered care plans. We don't just come in and dictate what we're going to do. We go in and we assess and we have conversations and we see what is it that the person and the family wants and needs. And then we develop that care plan together. And, you know, if that is, do they need respite care? Do they need supplemental supplies? Do they just need some training and education? We'll do whatever it is that is best for that person and that family. We have a great remote technology system called Care Predict, where it's a bracelet that the person with dementia wears, and it learns their behaviors over time. It can tell how often they're eating or drinking, using the restroom, sleeping. It can predict UTIs. It can predict if they're at a greater chance for fall. It can predict if they're depressed, and it warns their family members of these different alerts. So we're very excited about that program. We also can offer some small minor home modifications, things like shower grab bars and railings for stairs. So again, we go into the home and we discuss it with our clients and then come up with that plan that's going to work best for them. We also have a lot of new initiatives that are going to have a statewide impact. If you can go to the next slide, Jeremy. So one of the big programs that we're starting with the city of Pelham is a community paramedic program, and that's open to anybody who lives in the city of Pelham. And they have a team of 5 paramedics who will go into the home, and they'll do assessments and do welfare checks and just make sure that everything is okay, and assist in any way they can. We're also partnering with Asbury United Methodist Church. They are going to be having a adult respite program, and we're hoping that we'll be able to have that open later this year. And then we already have a great dementia-friendly program that actually Robin James and Jeremy Rains have developed and started, and then we're going to spread that statewide to train our first responders all across the state about dementia friendly. Another great education program that we're about to start in the next couple of months is going to be a healthy brain education, and it really looks at different ways that you can improve your health and potentially reduce your risks of developing dementia. So that is something really exciting that will be coming up shortly, and we're excited about. Jeremy did kind of already cover a little bit the Take a Stand programs that Robin has started, and at least 4 times a year, we're also going to do a focused one on elder abuse and preventing elder abuse, and what to do if you suspect it. So that's a very great program that Robin's been putting together for us, as well as she's been increasing our dementia marketing campaign. We are also collecting such valuable data through all of this that we can really use, and we're hoping to be able to expand this program statewide. You know, right now we're just piloting it in Shelby County, but we are hoping that we'll be able to expand this statewide. And our next slide, Jeremy.
Arlen, go ahead.
You can keep up and follow us on social media. If you go to our website, which is m4a.org, I believe it's right at the bottom of the page. There's links to all of our different social media accounts. So that is really the best way to know about our different events that are going on. So we hope that you'll check out our different pages. So Panda Project has one, M4A has one, and Alabama Cares has one. So you can follow all of us and know what's going on. And then you can also reach us. I think our next slide has our contact information. Our address is 209 Cloverdale Circle in Alabaster, Alabama. You can call us. You can go to our website again, is www.m4a.org. You can also feel free to email us at any time. The easiest one to remember is panda@m4a.org. And with that, I'm going to turn it over to Ms. Susan Ellis.
So we are really, really happy to be part of this program, and we are all hopeful that this is just the pilot and that we'll have access to the same kind of programming all over the state. People First, can you go to our, did you get our website up there, Jeremy? Okay, our website is www.peoplefirstal.net, and you can see little short videos that talk about our organization And just real briefly, we have been around the state for about 30 years. Our primary membership has started out with individuals that have not just developmental disabilities, but also intellectual disabilities. Most of our members have some sort of learning deficits or meet the criteria for an intellectual disability. And most of our members receive supplemental security income or Social Security survivor benefits that you can get as a disabled adult child when you have a parent who's also receiving Social Security services. We have chapters in every region of the state. We function with the same regions that the Department of Mental Health, who is our primary funder. We get an annual grant that allows us to have a very small staff, but a very impactful programs all over the state, because we're able to partner with folks like M4A and all the people that are part of the PANDA project. That's what we do, is really a lot of partnering with other disability advocates. Our primary goal is to ensure that people with intellectual and developmental disabilities meet their goals for living a good life. So we do lots and lots of advocacy training. All of our advisors are volunteers. Most of our state advisors are also family members like myself. We have a 37-year-old son with Down syndrome, and that carries me to a real interest in the topic of dementia. Many of you may know that in general, people with intellectual and developmental disabilities have a higher risk of acquiring memory loss or dementia. People with Down syndrome, unfortunately, have a really high indication for dementia. There's evidence that by the time of 40, individuals with Down syndrome, over 50% start presenting symptoms of some kind of memory loss or dementia. So that's something that we're going to be working on to get folks good screening at a younger age, and partner with some of the national organizations that do a lot of research. Everybody should look up the American Academy of Developmental Medicine and Dentistry. These are medical people who are really specializing in intellectual and developmental disabilities from the medical end, but really working on the correlation of dementia and memory loss with people with intellectual disabilities. So what we want to provide through the PANDA project is the point of view of individuals and families who experience developmental disabilities, so that when we're part of your care team, it's going to be coming from the point of view of people who experience those same kind of issues. Can you go to the next slide? Okay, so this is sort of our outline. We partner with a lot of state and local agencies. You can go ahead to go to the next one. So the first one, we have a lot of experience advocating for school-age children, which is ages 3 to 21, who have individualized education plans. We really work in the area of transition a lot and can give lots of experience for the past 20 years on getting the most out of the Department of Education experiences to help your family member experience a good adult life. So coming out of IDEA or the public school system, families should really advocate for excellent preparation for adult community living and work, just like you do for your family members who don't experience intellectual and developmental disabilities. Okay, you can the next partnership that we really work on helping people advocate to get the most out of is the Department of Rehabilitation. We believe that no matter what level of ability, there should be a zero rejection by the Department of Rehabilitation to serve people with significant intellectual disabilities and mild conditions as well. And again, that should start while your student is in high school. So the things that, even if your ultimate outcome isn't paid employment, which that's what we would be advocating for, you can get a lot of information from the Department of Rehabilitation to identify work strengths and interests and the kind of supports needed. There's all kinds of programs that they can do to help. If you don't have a resume, you can develop a resume by working with your rehabilitation counselor, who can provide on-the-job training and paid work experiences. They can provide assistance with job development and ongoing assistance. The rule would be you get as much help as you need, but as little as possible, as much as necessary. And then knowing that if something doesn't work out with the employment, that you can re-enroll. So it's a lifetime of eligibility. Okay, switch. The final thing, and this was touched on in the PANDA project, that we really believe in person-centered planning. And we are big proponents of a new kind of transformational look at folks with intellectual and developmental disabilities called Charting the Life Course. The framework that we are really transforming is ending looking at our family members as just objects to be placed into services and start looking through the lens of our families and our community. Research has demonstrated that people with intellectual and developmental disabilities have better outcomes when families are supported. So supporting the family is going to get the best outcome for the individual that's part of that family, whether or not they're living with that family or not. And then looking through that individual through the lens of their community and not just services. So it's a really good way to brainstorm about how to utilize the assets in the community and helping to develop assets in the community that may or may not be focused on disabilities, but might be welcoming situations for our families, members with intellectual and developmental disabilities. So that's kind of the role that we will be able to help with families that experience intellectual and developmental disabilities. We'll be having folks that live that life and be able to help them brainstorm and develop and then access the resources that we just talked about, but also help develop ones that are specific to their family member. Is that the last slide?
I think that's it, Susan. But I did, just for clarification, for your office, now you're primarily in the Birmingham region, right?
Correct, but we have chapters everywhere, and that's what we would do. We would resource, and of course the agencies that we're talking about, vocational rehabilitation, is statewide. So teaching families and individuals how to advocate for the best services, because the truth is, no matter if it's school or community or work, your experience is only going to be as good as your advocacy, which means the knowledge that you have. And that's what PANDA is going to be able to provide to families, is lots of knowledge so that they can get the most successful outcomes.
So regardless of where you're at in the state, you're covered.
Correct.
That's good to know. Well, we really appreciate it, Susan. We appreciate you joining us to review over this critical information that can really, like you said, the quicker you get involved with programs like yourself, the better outcome, the better we can help to to really provide those supportive services that so many families need and are really unsure about that they're available in the community. So with that, I'm going to stop sharing my screen and I'm going to pass it over to Ms. Crystal Whitehead, who is our caregiver interventionist with our Alabama Cares program. And she's going to be sharing a slideshow with us to review over our Medicaid waiver program. So Crystal, take it away.
All right, can you guys hear me okay?
Yep, and we can see your screen too.
All right, yay, I did it right. I'm so excited. You know, it's the small victory someday. Okay, so this is a whole lot of information and I'm going to move through it rather quickly so that we still have time at the end of this for any questions or concerns or any need for additional contact or outreach, so we can wrap up with that. But in general, we'll start with, sorry, I had two screens up and it was showing the wrong stuff. So in general, Medicaid is a healthcare program for low-income Alabamians. It covers different services based on age, income, and situations. You can always go to medicaid.alabama.gov, and I've got an actual little link in here if anybody writes a lot quicker than I do, where you can actually get a PDF version of all of the different programs through Medicaid that are offered. Now, what we're talking about specifically today are the home and community-based waiver services, or HCBS waivers. These provide additional Medicaid benefits to specific populations who meet special eligibility criteria. Individuals who are receiving services through the HCBS waiver are also receiving full Medicaid, but not everyone who receives full Medicaid benefits are eligible for home and community-based waivers. So that's where it gets a little bit confusing, because everything's called Medicaid, and then you have to figure out, are you talking about home and community-based waivers, or are you talking about traditional Medicaid insurance? Or for those of us who are a little bit older, we receive a special type of Medicaid that allows us to have assistance with Medicare premiums and things like that. So again, focusing on just the home and community-based waivers, there are actually 6 different types of waivers, and each waiver covers a different service, and each waiver has its own eligibility criteria, and they're operated through separate departments like Department of Senior Services or Department of Mental Health or Department of Rehabilitation. So in general, now these are general criteria that are pretty much, well, they're just general. They're applicable to most of your home and community-based waiver services. So you have to start with meeting the financial, medical, and program criteria for the specific waiver that you're applying to. Some of them have age requirements. Some of them require specific medical diagnoses in order to access that waiver. And the fourth one down here that you want to draw attention to, the applicant must also be at risk of institutionalization. So this is either a nursing home placement, intermediate care facility, or some other type of out-of-home placement that without benefit of these services, these people would no longer be able to remain in the community. Now, when we're talking money, money is what the state is going to focus on first and foremost, because it is a requirement to participate in Alabama that you maintain financial eligibility for Medicaid. So the way they figure out financial eligibility for waivers is they calculate up to 300% of the poverty level. So this is going to change from year to year. So for the year 2020, that amounts to $2,349 per month. If you earn more than that, if your retirement, pension checks, all of that add up to more than that, $2,349 a month, you wouldn't be eligible for a waiver. Now, the other part of that is you can't have more than $2,000 worth of assets. And we're going to talk about that in a little bit more detail on the next slide. But this is, you can have a savings account, but it has to be a very minimal type of situation. Now, the other part that you're going to have to finagle, and it's going to change based on what your situation is. There's special rules that apply for individuals in nursing homes or other medical facilities that have spouses at home living in a shared home and that kind of thing. As far as resources, what Medicaid is going to look at, and everything is going to be reviewed by the Medicaid district office. They're looking at cash, the equity or mortgage value of your home, life insurance policies, stocks, bonds, promissory notes, all of that good kind of stuff. Now, they will allow you a limited life insurance policy provided that it does not exceed a face value of $5,000. The exceptions to what counts as your resources. They're not going to count your household goods and personal effects. So if you inherited your grandmother's jewelry, that's not considered one of your resources. If you have insurance policies with a cash surrender value of less than $5,000 combined, then, you know, they're not going to count that as a resource. Now, where you get into a little bit of stickiness is when you talk burial funds, because what they're going to do is they're going to balance the cash value of your burial fund with the cash surrender value of any insurance policies, and those combined can exceed $5,000. But you are able to go ahead and purchase your burial space items like casket, vault, crypt, burial plots, markers, grave opening and closing expenses. And you can, if you're receiving home and community-based waiver services, you can still have one automobile per household as long as it's used by the household member. So more kind of stickiness that goes in there. They're not going to count your house against you if the intention is to return home from a medical institution. So if you're doing a short-term nursing home stay, then obviously they're not going to require you to sell your house as part of this. And they won't count your house against you if you happen to be a long-term nursing home resident, provided you are making a legitimate effort to sell the property. Or if a spouse or other dependent relative, like if you're a parent and you have an adult child with a disability such as Down syndrome or another protected population group, then if they're still residing in your home, even if you're in the nursing home, that home is not going to be counted as an asset for you. Other exclusions, income producing properties and property in a life estate. Again, all of this information is going to have to go through the district office for approval, but if you want more details on that specifically and appropriate ways to quote unquote spend down money so that you qualify for Medicaid, because there's specific things that you can spend your assets on that will allow you to spend money without being penalized by Medicaid. So I'd strongly encourage you to get directly on the Medicaid website for that. Now for M4A, we actually administer 2 of the 6 waivers that are available for those eligible for home and community-based waiver services. The first one is the Alabama Community Transitions Waiver, or ACT waiver, and the other is the Elderly and Disabled Waiver. Now the ACT waiver is a little bit newer. We'll talk about it first. This is the waiver that's the target population are the individuals who are currently residing in nursing home type situations and are trying to return to the community. Now, there is a very small opportunity for folks who are receiving other waiver services and their needs aren't adequately being addressed to apply for this waiver, but that is, and I cannot stress this heavily enough, that is a very rare exception. Traditionally, the only way you are going to qualify for the ACT waiver is in order to return to the community from a nursing home. So the services that the ACT waiver can provide, pretty standard services: case management, transitional assistance services, personal care, homemaker, adult day help, home delivered meals, respite, nursing, companion, some home modifications and assistive technologies, things of that nature. As far as signing up for it, again, it is a very, very rare occurrence for this to get started in any other way than someone trying to transition back home from a nursing home placement. So what people are going to tell you about the ACT waiver is that you have to be in the nursing home, and their social services staff within the nursing home are going to be the ones to start the process. And then once you have completed the process on the nursing home side of things, then they're going to send it to whichever AAA covers your area that you're discharging from. Now, as far as the elderly and disabled waiver is concerned, that is designed to serve individuals who are obviously elderly and or have a disability that places them at risk of going into a nursing home. There's no age requirement for the elderly and disabled waiver, which, you know, you hear elderly and disabled and you think there's going to be an age requirement, but there actually is not an age requirement. So for the group that we're speaking to tonight, it might be interesting to know many parents will apply for the elderly and disabled waiver services while they're on a waiting list for another home and community-based waiver service that might be more beneficial to their loved one, but what they're really needing is help and support in the here and now, and this is a way that they access that. So what the elderly and disabled waiver service covers: case management, homemaker services, personal care, adult day help, respite, both skilled and unskilled, adult companion services, and home delivered meals. Now, what you're noticing in here is this particular waiver does not cover transportation services. So what that means is you would have to access your transportation services through the non-emergency transportation assistance program through Medicaid, not through the waiver itself, but through the actual Medicaid toll-free number that you'll have to call and schedule all of that stuff with, because the workers that are in your home with elderly and disabled waiver service, they cannot transport people. We get a lot of confusion about that, but it's just because Medicaid has different avenues of paying for that. So it's not covered under the waiver, but it is covered under your full Medicaid waiver benefits. Now, with how to apply for the elderly and disabled waiver services, you're going to contact your local area agency on aging or the toll-free number 1-800-H-LINE. One of the intake specialists is going to collect your information and make the referral over to the Medicaid waiver unit. The benefit of getting into the ADRC intake specialist is that in addition to screening you and getting your information set together for Medicaid waiver services, they're also going to check and see which other services within the area agency on aging you would qualify for, like prescription assistance with Senior RX, Medicare counseling with SHIP, and any other local resources that they might have. At that point, Medicaid waiver is going to have a worker that's going to get in touch with you to get the more detailed information and start the ball rolling with your physician to determine your medical eligibility. And then at the end of all of that, that's when your information is going to go to the Department of Senior Services, who oversees the elderly and disabled waiver. And once that is approved, you're going to be assigned a case manager, and they're going to start locating services for you. So next up, the other waivers that are probably very beneficial to those joining us tonight, because these deal specifically with individuals who have a diagnosis of an intellectual disability and or a medical condition that means they require assistance for maintaining their independence and remaining in the home. So we're going to start up with the Department of Mental Health waivers. The first one, the one that most folks want to get plugged into, is the HCBS waiver for persons with intellectual disabilities, or the ID waiver, which is very confusing because a lot of people apply for the ED waiver thinking that it is the ID waiver. So the target group, again, individuals with a diagnosis of intellectual disability and individuals meeting the intermediate care facility for individuals with intellectual disabilities level of care. You have to be age 3 or older to access this waiver. And then you have your financial eligibility that is similar for all of the other waivers, with either receiving SSI, you're in an SSI related protective group, or you're deemed eligible for SSI and Medicaid, and your income is no more than 300% of state federal benefit rate. The reason a lot of people with children with conditions like Down syndrome or autism or things of this nature, the reason that they really want to apply and get on the list for this waiver is this is the waiver that allows you to access job coaching, specialized medical services, occupational therapy services, speech and language therapy services, crisis intervention, counseling, housing stabilization, and then you get the supportive employment services. So if you have a physical disability that means that you need assistance with going to the bathroom while you're working, they can have somebody that can come out and be your personal care assistant while you're at a work site and things of that nature. So this is the one that most folks want to get into. It also does have the capability for residential habilitation training services. And this is kind of going out of form a little bit with the idea of preferencing community-based services as opposed to residential services, but it does still allow for a residential placement that would allow them to maintain independence but still have some supportive services with them. Now, the next one that's also offered through the Department of Mental Health that people are really interested in, and this is a newer waiver. It has the same criteria as the intellectual disabilities waiver. The difference with the living at home waiver is it doesn't offer the residential habilitation services, which is what we used to back in the day refer to as a group home situation. This is specifically designed to keep them in their home, in their community, but it does still offer job coaching, job development, occupational therapy, speech and language therapy, and those kind of things, as well as crisis intervention and benefits counseling and assistance in community integration services. So this is another very valuable waiver if you have an individual that is wanting to remain in the community and wanting to be active and as productive as possible in the community. These two waivers, the intellectual disability waiver and the living at home waiver, are really designed to help with that. The next waiver that we're going to talk about is the independent living waiver through the Department of Rehabilitation Services. This is the waiver that requires specific medical diagnoses. So this is the list, and again, including but not limited to quadriplegia, traumatic brain injury, ALS, multiple sclerosis, all of these things that a person can be diagnosed with that would qualify them for this particular waiver. The requirement for this waiver is you must be 18 years or older and meet the financial criteria for Medicaid. Now, what you can receive with this is case management, personal care, personal assistance services, environmental accessibility adaptations. These are the folks that are in the community and they may not be experiencing a challenge with regards to how they're processing information like you would with someone with an intellectual delay. These are more designed to target for physical hindrances that require additional assistance to maintain your independence. So all of that being said, because I just did like 2 hours worth of a presentation in 10 minutes, all of that, if you have any questions, always give us a call. Obviously, since we administer the ACT waiver and the elderly and disabled waiver, we're going to be most familiar with that. But if you have any questions, if we don't know the answer, we can get you to the person who does know the answer. And another thing, can you see this little grid sheet, Jeremy?
We can.
Okay. So if you will go to medicaid.alabama.gov, because I just dumped a whole lot of information on you all at once, you can go to their long-term care waiver page on that website and pull up a grid that's going to make it a little bit more easily navigable and tell you how many slots each waiver has and what the requirements are and who the administrative body is for that and how you can get in touch with them. So that is a great option for you if you have more questions. And I will stop sharing my screen now and give it back to Jeremy.
Thank you, Crystal, for that elaborate yet very informative. Like you said, it's a 2-hour presentation that you had to pack in here in just a few minutes. So I don't see any questions so far on here. Again, if you're watching this later, you may have questions on our Facebook page or on our YouTube channel. So feel free to ask. Again, probably one of the most simple emails that you can quote or remember, as Jennifer mentioned earlier, is panda@m4a.org, PANDA at the letter M as in mom, the number 4, A as in apple.org. And we can get those questions distributed out if there's anybody that has any type of issues or questions that they need to have addressed, or to simply, if you just need assistance with, getting into to try to get screened for benefits, just let us know. Looks like we have someone with their hand raised, so I'm going to attempt to allow you to talk. If you don't mean to, just let me know. Or it looks like we posted in the Q&A. Here we go. Okay. So HCBS stands, the question is, I agree with the PowerPoint about Medicaid. What does HCBS stand for? That stands for Home and Community-Based Services. So that can range, there's a variation of home and community-based services, different waivers that are throughout the community. Medicaid waiver is kind of the general term, but there are several different Medicaid waivers that provide services like the ID waiver, the elderly and disabled waiver, et cetera. So there are different waivers, but HCBS specifically stands for services that are basically provided in the community setting versus a long-term care facility. So I think that's all the questions that I see so far. So I did want to pass it on over to our marketing director, Ms. Robin James, who's going to close us out. We're ending a little bit early. Typically, we don't really know how long these things are going to go because we don't know if we're going to have a ton of questions or not. So again, if you have any questions, feel free to email us, post them on our YouTube channel, on our Facebook page, email us, call us, whatever you got to do to get it to us, and we can definitely take those questions and try to get them answered for you. So, Robin, I'll pass it to you.
Okay, thank you. Thank you so much, everybody, for joining us this evening. This is our first webinar, really, just to share resources with our partners and with all of you to help you, support you with your caregiving with intellectual and developmental disabilities. Another great resource that I wanted to share with you is the ARC of Shelby County, and their website is the ARC, which is ARC of shelbycounty.org. Karen Stokes, I see, is on our webinar this evening, and it's just, they're a great resource, and they do a lot of great work in the community across the county. Thank you so much for all of our panelists, and just a reminder to please just reach out to M4A.org, and just, we are really the starting point for to serve people of all ages at all stages of their life, and we can connect you to a lot of different resources. And again, thank you, everybody. And we do plan on having future webinars similar to this. And so please just reach out to us and get those dates. And we would like to do this quarterly. So we appreciate all of you, and we appreciate all of your feedback. So thank you so much.
Thanks, everybody. Have a great evening.
Thank you.
Thank you.
Thanks.